Well, welcome back to the podcast. I'm your host, Ben Imes. Excited to have another episode today with a new guest. We have a new doctor on the show. I'd like him to introduce himself and kind of introduce him to the audience. Yeah.
Awesome. Well, Ben, thank you for having me here today. My name is Dr. Stephan Goupil. In short, I have had a very twisty, windy career path that has led me here. So you can always delve back into that if you want to. But I was a philosophy major as an undergraduate. I got a PhD in genetics and biology of aging. I worked in biotech as a second career, which through my wonderful wife for a boomerang kind of thing, and she supported me in my thesis. I went back to medical school with sort of a plan to possibly become a medical geneticist, because that's really
Sure.
what I love is like
Perfect.
genetics, the cutting edge of technology and science and stuff like that. And then I spent a good deal of time training as a physician. If you
Yeah.
weren't aware, well, as you know, it
If you
takes a
weren't
little
aware.
time. It's not like a quick, like overnight class kind of thing.
This isn't a side hustle.
No, not a side hustle. And so I became enamored with family medicine. I think because the broad scope and the generality of it always sort of appeals to me. I finished up a residency. Actually, I'm a DO, a doctor of osteopathic medicine. But then I did a residency at UMass. After that, they say it usually takes about 7 years to really get your footing as a physician. And so I started out doing urgent care for about 6 months as I was looking for a primary care home to find.
Sure.
And I went through a couple of those. I worked with employed in what was a great opportunity. They allowed me to kind of do what I wanted, which was spend a lot of time with my patients,
Right.
focus on the two big things that I think you see in primary care, which is mild to moderate mental health issues or chronic diseases that are oftentimes related to lifestyle interventions or lifestyle choices.
Yeah.
That I did start to feel the pressures there a little bit of what I call assembly line medicine.
Mhm.
They gave me broad scope in the beginning, but then they quickly were like, hey, why don't you see more patients? Why don't you see a lot more patients? Why don't you spend less time with them and move faster kind of thing? That pressure combined with the COVID pandemic hit at that time, that practice did not survive. Just before it closed down, I was recruited to a secondary practice that once again gave me that broad scope. There was actually a DO that was the medical director there who practiced osteopathic manipulative medicine, which
Cool.
if you're at all familiar with that, like is a rarity. Most of us go to DO schools just to be a physician,
Right.
which is no different than an MD for those that are not aware. MDs, DOs in the United States do everything, can become everything all the same. And so I worked with that practice for a couple years associated with Mass General Brigham, doing what I always did, more and more lifestyle stuff though. And that's actually where I then also became board certified in lifestyle medicine in conjunction with family medicine. That practice also narrowed my scope a little bit because it combined internists in the practice as well as family medicine docs. So we only saw adults and up. So it was like basic primary care kind of thing. Same kind of thing. I was doing my thing, spending a lot of time talking with my patients more than the person sitting next to me, but really drilling down to root causes, talking to them about lifestyle medicine and chronic diseases and evidence-based medicine kind of thing.
Yeah.
Always in the back of my head, having that feel for like, when's it going to happen again? When are you on the assembly line?
It's
What
coming
can you
soon.
Yeah, exactly. And what could you do about it? I mean, I'm a big dreamer. So in the back of my mind, I always was like, well, what's the most idealistic possible goal? Like, well, just imagine having your own practice and doing that and skip right over all the problems that you'll run into in creating that, but hold that in the back of your head. And even somewhat like what I could have done is like you hold that at the light of the end of the tunnel that you never get to, and then you just keep grinding on in traditional primary care. And I probably would have done that, except I'm the type, if you didn't see it in my brief sort of background, frequently jumps when they see some things that kind of
Opportunity or something, the shiny object.
Exactly. And so I felt really fortunate. I saw the shiny object of a concierge functional medicine practice that was in the greater Boston area that was looking for docs. And I was A little, like I do. I'm not completely crazy. I don't jump at every squirrel or shiny rock that I see. And I did for a while. I kind of was like, okay, I know functional medicine. I like a lot of the overlap with lifestyle medicine, but I questioned sometimes, do they do a lot of the supplements that I wasn't big on,
Mm.
or like toxins? And so I was just like, I don't know if this is a perfect fit. But I also was like, you can't judge a book by a cover. So again, jump right in and
See what you experience. Yeah, yeah,
see
yeah.
what it was like, and maybe getting a primer to one of, I think, your questions coming up. 30 years of training as a scientist and a clinician, I had no background experience really in small businesses or how I would ever get to that light of the end of the tunnel of creating my own practice. And so I thought maybe I could work for these guys for a couple years, learn what they do, learn what functional medicine is all about, and learn how they do it in a setting where it's a small business kind of thing.
Sure.
And they were really, really great. But that we did, after a couple months, we saw that our philosophies slightly diverged,
Mm.
and we chose to sort of separate amicably. And I was kind of like, well, what should I do now? Like, I asked them on my exit interview, I'm like, do I crawl back to primary care and just grind on? And they're like, absolutely not. Like, you have vision, you have talent, you connect well with the patients. Take another giant leap of faith and you should try and open up your own practice. And so we talked a little bit
It's
about,
interesting how they encourage that, because you could be seen as a competitor, but they're like, no, they want to foster that growth in you.
yeah, and I really like, I applaud them for that, because again, it could have gone another way, and I always did, even when like I left with some of their advice. I'm like, how much of this is going to be like, well, you're a competitor, so like,
Right, right.
how is that going to kind of be? But I think they were pretty straight up. I mean, one thing was geographically, we were going to be in different areas, even though it's the greater
Okay.
Boston area. It was enough distance that I think they felt like, hey, he's not really infringing on our territory. And I think just like with the lifestyle medicine community, at least with them as a functional medicine practice, I felt like they were like, they truly believe in it. And so they're like, better to have another doctor that is
Sure.
practicing like this
Yeah.
than to have people without this.
Yeah, they want to water you and watch you grow, because they actually care about the patients that they're taking care of at the same time, or the greater patient population of the earth, in a
Yeah.
sense.
And I think that's what it was. And so they helped me. And it was a very sort of brief primer. They're like, okay, just big picture. Like, what do you want to do? Like, you've got to make some big decisions. Are you going to take insurance? Are you just going to do fee for service for every visit? Are you going to do some of the new models of membership or program based? And we kind of like, well, and are you going to do it as like a small micro practice where you don't have to deal with the headache of like a lot of staff and stuff in the
Mhm.
beginning and slowly grow? And then also, the other one was, are you wanting to see patients in person? Are you wanting to just do telehealth? What are the advantages? Do you want to do a hybrid? And I think those three big pictures, before I walked out of that room in the exit interview, all three of us were like, I think private pay is what makes the most sense to you. Membership is the big thing. So I would do that sort of as like your business model, and maybe you still work with some of the fee for service just as you're feeling out like the
Sure,
market and growing.
sure.
But whereas they did do a hybrid insurance model, they're just like, with
Okay.
what you're doing in a micro practice, we think this would be easier for you. And I was like, I am looking for every easy step that you possibly can
Give me
give
the
me, kind of thing.
lowest hanging fruit of the low.
Yeah. And at the same time, we walked out of there, I was like, I know it's a lower hanging fruit that I won't have the overhead of a brick and mortar practice if I just did everything as telehealth. But I've seen over the years that that connection, even that first connection, is so critical. And so they're like, I think you want to do a hybrid practice. Find a place where you can at least sublet, that you can do like 1 day a week kind of thing, that you can see those patients. And then they once they get to know you, trust you, and see how great you are, then they'll be like, hey, I have no problem listening to Dr. Gopal or consulting with Dr.
Yeah,
Gopal
just like
down the road
telemed.
over telehealth kind of
Yeah.
thing. Because again, COVID trained a lot of people and patients how that's a great tool kind of thing. And so that's where I was. So a little over a year ago, I did officially open my practice. It's called Extended Health Spans.
Okay.
I position it as, again, something somewhere in between functional medicine and DPC or direct primary care, because I do
Sure.
think of
That's a
myself as
good
a
that's a good outline because it's difficult and there's a spectrum is what I see in terms of like the primary care that's not just a part of a big health system model. Can you speak more to like that spectrum in a sense?
Yeah, so the spectrum that I saw, and I did try to use this like with my lack of business knowledge, but like, okay, so how do I find someone that will do a website for me? Like, what message boards do I get on to start to learn about this? And I saw that both DPC, even though direct primary care, which tends to be private pay, small group membership,
Mhm.
primary care doctors. It's not, I haven't seen it as really big in Massachusetts or the Boston area, but it has a pretty big footing across the country and particularly in New Hampshire and
I was gonna
stuff
say
like
I think
that.
it's gaining. I think it's
It is definitely
gaining
gaining.
like more than people think.
It is absolutely gaining, but there wasn't a lot of it like in my immediate vicinity kind of
Sure.
thing. And
Sure.
so I used that as like sort of a bookend. And then functional medicine, obviously, if you're following anything at all, as things swing to, I don't want to put a negative spin on it, but as it swings to people that are looking for alternatives to traditional medicine, while functional medicine practices a ton of evidence based stuff, I think they also capture a lot of those people that are looking for an alternative. And so I used those to kind of look at like, how do I create this business and how do I sort of price myself kind of thing.
I one thing I actually wanted to touch on that you've actually gone over already just in your sharing is about the how you bring the lifestyle kind of medicine to the table. Like that's a gift and that's a strength that you have in your arsenal. So can you explain that more for the listeners of what lifestyle medicine actually is versus, reactive care medicine, chronic care, chronic illness kind of, taking care of
Yeah.
patients like that?
Yeah, so without defining again what functional medicine is, but traditional medicine, I mean, and I think it does get like a bad rap. A lot of good primary care doctors are recommending lifestyle interventions. They're
Yeah.
trying to be preventative. They just, I mean, I don't think we used it in the video yet. We talked about beforehand, or no, we did. Like, very much they're on this sort of assembly line, industrialized
Yeah.
practice where they just don't have enough time to do anything other than at that once a year preventative visit where the patient comes in with a long list of things that they
Yeah.
want to talk about. And so the doc is like, well, I want to talk about preventative stuff. This is the one time I get to do it. And I definitely think that you should be engaging in lifestyle interventions. But all they get to say is you should exercise, you should eat better, and then they got to move on to something else. And so lifestyle medicine, and what I loved about it when I found it and was already starting to practice it through a connection with mind body medicine that I had long had learned in medical school and in medicine. But as I branched out into learning about like exercise and nutrition, I found, hey, there is this group that's been doing this for a long time and they board certify, and their significant underpinning is it is evidence based. Like, we do the trials to say that this stuff works. And so what lifestyle medicine does, it definitively has been proven to prevent, treat, and even reverse, which is amazing,
Yeah.
mild to moderate chronic diseases. What
Yeah.
makes up lifestyle medicine? So lifestyle medicine, this is always the scary thing for me because I'm like, what you're selling is common sense kind of thing. But
It is, but it's not. I mean, because we've been through the training. You and I have been through the training, and I remember, I mean, the answer for the test is lifestyle modification. Okay, that's a whole uncharted territory that you could go into depth about, like super, super deep, but then you're like, "Oh, just eat better, walk once a day, and you'll be fine." And it's like, okay, everybody's very subjective though. I know people who work out a ton and they're not healthy.
yeah,
It's
yeah.
like, what is health in that sense?
Yeah, and absolutely. So the six pillars that they kind of look at in lifestyle medicine is diet, exercise, minimizing toxins, like obvious ones like tobacco, alcohol,
Sure.
drugs and stuff like that. Stress management. So that's where that mind body connection that I had always
Gotcha.
had, I had been practicing that and had always been talking to my patients, which was an interesting question because, like, in my preventative visits, I'd be like, so has anyone ever talked to you about like meditation? Do you practice it or know anything about it? And so I would use that as an opening. And so that was stress management. The other pillar is try and get good sleep. And that's the one that the patients would always love, and I would always have it as the thumb because they'd be like, let's fix that one. And I'm like, at the time for me, before I had a lot of training, I was like, let's fold that thumb back right now because that's a tricky one to fix really easily. And let's work on the
Mm.
other ones. And then the last one that I was actually not really introduced to until I became board certified is healthy social interactions. And again, all of these have a ton of evidence that show that they can prevent, treat, and even reverse mild to moderate chronic diseases.
When is your book coming out?
When it's okay for me to just tell AI to write the book for me and I can stamp my name on it, kind of thing.
I'm sure people have already done that.
And I also feel like there's enough books out there already. I mean, there's
Yeah,
a lot of different ways that you can go in lifestyle medicine. You see people that are doing things, which I definitely advocate and think what you're doing great, but is great, like doing webinar, podcasts and stuff like that. And so I actually questioned when I was going down lifestyle medicine, was that the path? Like you stop
sure.
practicing medicine and you start talking and being a content generator and like write books and stuff like that. And I'm like, that's not what I want to do. I just want to practice medicine
Yeah.
in this capacity, kind of thing. And so
You can
that's what my practice is about, kind of
And you
thing.
can kinda see it being a temptation, though. Like, I know that it's in the back of your mind, like, people in your community that are teaching the similar things, probably have jumped into it with both feet, right? But, I mean, from what it sounds like, and I think the listeners are definitely hearing, is that you care about the people. Like, you wanna help the people because you're so inspired about what you've learned so far. I mean, what are some of the things that you've seen and kind of, I mean, just touch on, give them a little taste of the reversal of chronic disease,
Yeah.
like that kind of
So
deal.
I mean, one, you can always go to the evidence, which is really cool and clear out there. Like lifestyle
Totally.
medicine has shown that, with many published peer-reviewed papers. This is the tough part, though. Oftentimes, when you look at those papers, it is pretty aggressive interventions with lifestyle medicine. So you do have to get more aggressive than just telling them healthier or patting yourself on the back because you say, well, follow a Mediterranean diet. There you go. Like I gave them all the answers right there. Now we can move on to just walk every day. And now you've clicked off two of them, kind of thing. But a lot of times the papers are pretty aggressive exercise regimes. Not that they have to be hard, but that they have to be consistent, or that the dietary changes really do need to include a lot more plant-based food stuff and a lot
Mm,
less processed stuff, and really trying to minimize meat if you're not going to eliminate it altogether. But those studies have shown reversal in cardiovascular disease and reversal in diabetes, at least in mild to moderate. And so that's the data. At the same time, when I was practicing this with my classic, like all over the place kind of thing,
yeah.
while I was on the assembly line, I did have a handful of patients where I always say, again, at one point in my life, I was a biology professor. So, like, give me the space to talk. And I used to have to when I would do my weekend classes, I would have to lecture for 3 hours. So, you got to be careful with me. Like, I'll just keep talking and talking and talking. And I've got to be very cognizant of when the audience is glazed over,
Yeah.
particularly when that's a patient. But, like, I had several patients where what you needed was that they got this, or they were scared about things that were happening in their life, that they were starting to
Mm,
see cholesterol, or they had a family member that had died early from heart disease or something like that. And
sure.
so they were really invested in jumping in this. Or like everyone's always invested in, I want to minimize my meds, but it's like,
Totally.
okay, what are you going to do about it though, kind of thing.
Can you put in the work?
But it was cool because I would always say, like, it's not a lot, but I'm like, over the last couple of years when I was practicing in traditional primary care, I'm like, I have a handful of patients that I can point to that I say engaged heavily in a lot of these lifestyle medicine interventions, particularly diet, exercise, and stress management being
Yeah.
sort of the big three that they had to like really make changes in. But if they did that, like I had patients that we reduced blood pressure medicines or were able to stop blood pressure medicines or reduce like initial diabetes medicines like metformin. So
Wow.
again, not groundbreaking stuff that I could have published a paper on when it's like an N of 5 or something like that.
Sure, sure.
But for that patient where they were able to get off one blood pressure medicine, or for that patient that was like, wow, we actually stopped this and like my blood pressure is okay. I'm happy with
Sure.
it. And more importantly, my physician is saying, no, it's okay. Like we'll keep watching it, but like what you're doing is working and we don't need that med anymore right now.
Yeah.
So I hope that answered that question.
No, it totally did. I think it's really unique to see. I mean, you do have to have kind of a two-part patient engagement, right? Like you can't just say, "Cool, so you have all these litany of chronic diseases. Let's say you got the classic triad of, triglyceride, you got hyperlipidemia, hypertension, and diabetes or something like that. The classic
Yep.
triad.
Yep.
And you're like, okay, well, usually with those three, we can just throw meds at them and just say, cool, here you go. But if the patient actually expresses that they want to get better, you have to help them buy in. Like, you can't just say, cool, we're going to throw meds at you and this should get you better. Some people do want that quick fix. That's the
Yeah.
American way, in a
Yeah.
sense, of give me the quickest route to solve this problem so I don't have to think about it anymore. Right.
Yep.
And that's
But don't make it a medicine. Make it like a natural supplement that like I can pay for out of pocket instead of having covered by insurance. That's the one that always sort of surprised me. I'm
always
like, you don't want to be on the statin, but you're willing to take 10 supplements that like,
that are kind of not FDA approved.
yeah.
What's actually
And
your
not that they don't work because
totally
actually more and more like I am like getting on board and I'm like, man, like so in the functional medicine and the longevity medicine, I've seen this term where they talk about like, well, what is your stack? Which like means like what are all the supplements that you sort of take?
oh,
And
yeah.
like I've always been like, when I started out on this, I'm like, no stack. Stack is not for me. Like that's not something that like is a big component of like what I do for my patients. But like I've
Right.
started to be like, well, there's data that supports like supplementing with omega-3, like
Yeah,
oils,
yeah,
and like vitamin D swings back and forth and back and forth and
totally.
back and forth. But at the same time, like I think there's a lot of stuff that says like taking that as a supplement can be beneficial. So there's a couple things that I'm starting to be like every now and then I look at like I'm like, man, I have a stack now.
Do
I
I have a
take
stack?
I take a fiber supplement. I take vitamin D, like I go omega threes. And so I'm like, that's the start there. And then
Boy,
once I start really looking into the longevity stuff, which I always say is sort of the icing on the cake of doing a solid preventative lifestyle intervention and traditional medicine sort of practice, but
right.
there is that cool icing on the cake of functional medicine and lifestyle medicine. Sorry, functional medicine and longevity medicine. That is where you can quickly get into like things like, oh my God, there are so many supplements that have some basic sort of science behind it and
And you're
so
like,
that
I could argue for it, but I can't quite fully discount it at the same time. It's kind of gray, right?
yeah, and so that's why in my practice actually on my website I have this diagram that I thought was really cool that sort of like represents like my philosophy and like foundation of how like I present to or I initially engage with a patient. And I want to point out that part of my concierge practice also is it was about giving time and listening to the patient. So I don't care if I come to you with like Dr. Gopal's prescribed like recipe or protocol for doing this. I want to hear what you need and what you want. And then like we come together with this. But like the framework that I present to it is like preventative medicine. If you're not preventing, then you're just hobbling yourself like at the knees to begin with. And then, well, what are you going to do for prevention or initial treatment in mild to moderate chronic disease? Well, again, we've got something nice that people are usually willing to approach because it's not pills and it is evidence based. So that's where I start with lifestyle interventions. Again, they then sometimes find that there's a lot of work to it. They put in a lot of work, takes time though. And again, if we're not making the headway we want, I
Right.
bring up, hey, I'm still a traditional doctor. Like,
We can
if
still
your
do
blood
medicine.
yeah, we can still do medicine. And what's interesting there at that point is like I always look back at my practice because the statistics were like abysmal. Like they used to tell us in residency that like only half of your patients are taking the medicines you prescribe.
Oh my gosh.
And I was always like, my patients are absolutely lying to me, which they also say, well, 10% of your patients are lying to you. But I'm like, no, my patients, like my patients, most of my patients were taking their meds that I told them to take. Or every now and then we would have ones where it'd be like, okay, like I'm forgetting to take it occasionally. And so it'd be like, okay, let's figure out what's working for you. But I was like, I think my numbers are way off from that statistic. And so, like, the scientist in me was always, well, question the data. Your data is just wrong. Like, and you're just like everyone else, and it is 50%. I started to dig deeper and I started to have like more faith in myself as I practiced medicine. And I'm like, no, what it is you've built a relationship with these patients, you've built trust with them, and you didn't just go to shove a blood pressure medicine or a statin down their throat right away. You said, hey, man, like this is your life. This is your game. We can take our time. We can do lifestyle
Yeah.
interventions. They're proven. This isn't going to, for most of you, like when it's mild to moderate, I'm like, this isn't going to kill you in the next 6 months, 12 months, 18 months. So you can lead me. I'm just telling you that, like, if we don't bend this curve or change this curve, this is what could kill you in probably not even 10 years, but 20 or 30 years kind of thing.
Yeah,
So,
and do you want to minimize that risk now and start working towards it now, or do you just, want to focus on the short term? It's like it's always a choice and a discussion that you have to come to with your patients. Like,
and so with them, like I was like, look, like let's also start to put metrics in place. Like you don't want to take this medicine. These are the things that we're watching. And I've explained to you why. Like higher blood pressure makes you more at risk of having a heart attack or stroke. And I can do risk calculators based on the cholesterol numbers you have. And so yours are okay or borderline. But if your blood pressure goes up, or if your cholesterol goes up, or as your age goes up, which you can't control, your risk is only going to go up. Like we can try and mitigate these as much as we can. And if we do that, great. But at a certain point, you as an individual, I'll give you some guidelines that like most doctors recommend or what I recommend of where I would say we should then start a medication. But I'll let you do some of that risk analysis. And again, it gives you time because those things don't go up very quickly. And when you're doing that type of primary care, sometimes you're not seeing them again for 3 months or a year. And so it gives you the time to say, okay, so what did you do? You did nothing. And look, the data hasn't changed. So at what point do you want to engage in traditional medicine? And what's
right.
really cool with, again, that pyramid sort of philosophy I have, I'm really excited as a scientist is I get to do a lot more advanced labs.
Love that. You're one of the unique people probably in that hemisphere who's able to also kind of go over those specific lab results with your patients.
Yeah, and they do. And what is also neat, like the functional medicine guys actually do a pretty good job of this too. And I think the primary care doctors, it's going to start to get shoved down their throat just because people are becoming more proactive. But when I say advanced labs, like the funny thing is these aren't like that advanced. These are labs that like we've known about for decades and have evidence behind them. It's just, as you know, it takes a long time for like evidence-based science to trickle into clinical medicine.
What kind of ones are you talking about? Like prolactin, DHEA, and stuff like that, or
I
something
mean,
different?
you're even getting a little bit like, yes, I am doing those now in my type of practice, but the low-hanging fruit for me was LP little a or lipoprotein A
Oh, yeah, yeah, yeah.
and ApoB.
Yep.
And like those were the first ones that I sort of adopted. I mean, I'm a big fan of like Peter Attia and some of his stuff, and so that's where I was introduced to like personalizing. One of the biggest chronic diseases is cardiovascular disease. And again, whether you talk about like I used to have with my patients like what we would jokingly call the wall of death, which was the 10 most common causes of death based on what the CDC said,
Yeah.
or Peter Attia uses his four horsemen of the apocalypse, which is just
Right.
an overlap of that kind of thing. I
Sure.
mean, we're talking about heart disease, metabolic disease, neurodegenerative disease, and cancer. But what I really like when I first started in this practice, my real comfort zone was cardiovascular disease, and it is the biggest player kind of thing. And I
Yeah.
think it grew from I loved working with patients on like a traditional sort of lipid panel and having things like risk calculators that you could put data into and tell them, hey, like your 10-year risk is this. And so you could kind of frame it with things that were definitive for them to know and to point out that like this is what would change it. If your blood pressure got lower, this risk would come way down. Or if your cholesterol or your triglycerides goes up, your risk is going to go up
It's all
kind of
about the
thing.
percentages. Yeah.
Yeah. And so, I mean, that's sort of my real comfort zone. And LP little a, like just with one of my first patients, it actually like just blew my mind about how like big a player this really is.
Sure.
Because I had definitely HIPAA respectable. So this is very, very general. So I'm just talking about a
Good.
general patient that happened to come to my practice that their PCP had, interestingly enough, done one of those calcium CT scores and found like the CAC, the one where they look at like
Yeah.
calcified plaques kind of thing, a low grade CT of the arteries.
You mean like a CCTA, basically?
Yeah, exactly.
Yeah. Yeah.
Like
Yeah.
with the calcium score that comes back with it
Yeah.
kind of
Yeah. Yeah.
thing of what the plaques look like kind of thing. And so when this patient came to me, they were already engaged with a cardiologist because
Yeah.
their CAC was not that great kind of thing. And so as I was like, hey, I need the data dump like before I order my labs, like what did your cholesterols look like and stuff like that. And so we were ordering what I kind of call my advanced cardiac labs, or I say what your PCP would do
Mm,
on steroids kind of thing. And so we had ordered the more advanced cholesterol panels that included LP little a and ApoB. And while we were waiting for that to come back, I got their basic panel with the LDL and HDL in it. And I was blown away because I was like, whoa, like I was expecting this to look a lot worse. Like
mm,
this, almost with my patients, I would have been like, hey, we can just ride this for a little while and do lifestyle medicine. I would not have been so aggressive that I was doing a CAC, a calcium score kind of
right.
thing. But what was really interesting was then my labs came back and the patient actually was, if you, for a better term, they had elevated LP little a or lipoprotein A.
Right.
And so, what this is in a nutshell, the way I always say, I dumb stuff down not for my patients because I think that they can't understand it. I dumb stuff down for me because, as you know, medicine and science is way too complicated. And I like to understand it and not regurgitate it. So, like, I'm like,
Let me
LP little
digest and translate for you, but I'm actually doing it for me.
yeah, yeah. And so LP little a, which is having an elevated lipoprotein A, is actually pretty crazily common. Like it's about 1 to 2 people in 10
Whoa.
have these elevated ones. And it is based on a genetic change. So the test you do is not a genetic test. You're not looking at the gene that they would have that would be mutated that would create this. You're looking at the actual molecule.
Mm,
How many of these lipoprotein A molecules are floating around with your other cholesterol that you didn't look at because you were just looking at LDL and HDL, bad cholesterol and good cholesterol kind of thing, and not the nuances. And so what I say is what lipoprotein lipoprotein A is it's mutated and it's more sticky and it's got this tag or tail hanging off it that makes it harder for your body to filter it out. And so what you don't want in a cholesterol is it to be sticky and stick to your arteries and stick around, for lack of a better term, because your body can't filter it out. So it's a double whammy kind of thing. And
Right.
that's what it was with this patient. While their traditional, like LDL was a little bit elevated, HDL was a little bit low, triglycerides were just mediocre kind of thing, but their calcium showed calcified plaques like in
Mm,
their arteries, which is borderline. This is not moderate. Like this is starting to be severe. You need to start be engaging with a cardiologist kind of thing. And so that was the aha moment for me. I was like, this is absolutely the answer as to why your risk stratification would be so different than someone that had similar LDL, HDL, traditional panel, but didn't have that lipoprotein A or LP little a
right.
kind of thing. So sorry if
Super
I didn't
cool.
geek out on that, but like that's the
If you
one that
didn't geek
started
out, that was we love to
to
geek
to
out here.
to lead into these. I haven't done a ton of it, but it also is where I would offer my patients because I think there is some cool stuff happening in the genetic testing realm
Sure.
now,
Sure.
not only looking for things like genes that may put you at higher risk for neurodegenerative disease, but there are people
Sure.
that are sort of actively looking at that these are complex, multifactorial kind of things. And it's not like one gene for heart disease kind of thing, but they look at these panels. And then what's really cool, some of them are starting to, what's important for us as clinicians is not only say to help you sort of risk stratify and say, hey, you're a little bit less risky or you're average risk or you're a little more risky. They
Mhm.
combine it with recommendations that are somewhat supported by evidence of like, well, for you, this type of exercise might work better. Or for you, we've seen that starting with this blood pressure medicine actually works better than that blood pressure medicine. And again, because this does fall into that longevity functional medicine realm,
Mhm.
they oftentimes will be like, and here are some supplements that has evidence behind it. And again, they easily can say omega-3 fatty acids because like a lot of the data sort of supports that
Yeah.
kind of thing. So those
Yeah.
are really cool. But again, that type of stuff, the Quest labs, like is those advanced blood labs,
Right.
ApoB, LP little a, even though I don't take insurance, a lot of times most of that stuff does end up being covered by insurance. But these other
Sure.
things that I kind of call functional medicine labs, like hormone testing, cortisol stress testing, or genetic testing ones,
Right.
tend to be out of pocket. And
And
the
have you been
genetic
able
ones tend to be expensive.
But have you been able to find ways to have an agreement with a lab so where people get like discounted rates or something like that, like at cost or whatever?
I mean, sure, in the same vein that, like, if you know how medicine works, Quest tells you when I order these labs for my patients, and because I don't take insurance, I give them an order, and Quest says these labs are going to cost your patient $3,000 kind of thing. That if the patient takes it to their insurance, they end up costing like a tenth of that kind of thing. And even I could do that
Okay.
with the
Okay.
patients, is work with Quest and say, like, I can get these labs for you for like pennies on the dollar kind of thing. So, I mean,
Sure.
you could
Sure.
say that these functional medicine people can upcharge you and say, this is the retail price for this, but
Sure.
for your patients, it's going to cost this. So,
Yeah.
it's
Yeah. Yeah. Yeah.
all business and moving pieces. So in that regards, yes, I get it discounted for them. But at the end of the day, what it is these things still can cost hundreds of dollars and it is out of pocket kind of thing.
Yeah. Yeah. That's the hardest part. I mean, speaking of like just, we kind of touched on it at the very beginning and then we got a little bit distracted.
Hey, a shiny object. Sorry.
Exactly. Exactly. We chased the rabbit.
Sorry, go ahead.
No, you're good. I just think about like, I mean, you weren't trained to be a business owner. And so when you have that shiny, light at the end of the tunnel of I'm going to open my own practice and do all this stuff. I mean, sure. I mean, there's so many facets, brick and mortar, insurance based, telemedicine, hire other clinicians, even maybe, or
Yeah.
even just support staff as
Yeah.
well. What's your kind of your magic secret or your secret sauce or the biggest, we'll call it your top 3 lessons that you've learned? Like, the most important lessons to learn as a business owner in the healthcare field. We'll say if you can
Yeah.
if you can whatever you've learned over the past few years, or even just the past year, I would say, if you can dilute
Uh,
your
if I can dilute
experience.
it down into 3, I mean, no, I can't. And I also can't say that I'm completely yet successful. Like right now, I'm trying to learn, like, how do I grow my patients? Because I think there's the market for this, and how do I find them, and how do I help them find me? But I think some of the things that I did learn, I think that you can apply is, one, you don't have to reinvent the wheel kind of thing. I mean, there's these bookends. There are people that are successfully doing direct primary care, and there are people that are successfully doing functional medicine. Apply, even though you have maybe 20 or 30 years of dedicated experience in learning science and medicine that has got you here, like you can apply that ability to learn and that critical thinking to what you're moving into now, which is a new subject. I'm going to be a small business owner. And so, how would you do that when you're a lifelong learner in medicine? Like, you got
Totally.
to keep up with the stuff and you've got to find the experts in it. And so, one of the things that I did do is I followed heavily and communicated a lot on the message boards with DPC docs and functional medicine docs. And I think the two things, it was do your research, and what helped me there, that did help me make two of my big decisions of what
Yeah.
kind of malpractice insurance, or what my malpractice insurance options were, and then allowed me to pick that. And then the biggest one, and the one that I lost a lot of sleep about, and I still sometimes have little regrets about, but picking an EMR was the biggest and scariest one. But I think
Wow.
those communities helped me a lot, even though I also fault them that I'm like, I kind of had a list of a dozen that maybe I could narrow down to 6. But like, if I didn't have that list, where would I have been, kind of thing. So, I mean, and it was hard when I got it down to 6 to be like, okay, these 3 are similar and these 3 are similar. So I want to go this way. Well, you still have 3, and then you've got to make a decision, kind of thing, and live with it. So that was one of them. I'd say engage also actively, like in your community. That's definitely, actually, that's been a big one. I was thinking of how that functional medicine practice that
Yeah.
I shadowed with helped me a little bit. So if you've got resources like that, or if you don't, reach out to them. I mean, the lifestyle medicine community is very supportive of other
Yeah.
lifestyle medicine doctors. I think functional medicine doctors often too are really nice people, so they can
Yeah.
help you if you connect with them. But where that turned me in a tangent was connect with your community. And so what I did, and some of my most successful initial marketing, was working with like my town and
Wow.
showing up. And I actually opened a local chapter of the nonprofit called Walk with a Doc to give back
Cool.
to the community. I sit on my town's board of health.
Cool.
I go to any of our farmers markets or health fairs to kind of show a presence. And with my background as a biology professor, I kind of put together this lecture, just a basic introduction lesson, kind of like what we did. What is lifestyle medicine? Why is it important? And what are the 6 pillars?
Yeah.
And so I have a 30 to 45-minute talk that I can then turn into some questions and answers that I gave with the Rotary Club,
Yeah.
the senior center, the community center, a couple local businesses, like anyone that was willing to have me come out and talk, kind of thing. And so I think that that worked really well. Like, start with your roots. Also, do your business to business. I
Oh,
mean,
yeah.
both your clinical connections that you have in the local community, because I say, like, I'm just part of a team. Like, and I still
Totally.
think your primary care doctor hopefully
You're
is
still
part of this
referring to
team.
the right
Yeah,
people.
you're still like looking for trustworthy endocrinologists, cardiologists, GI doc specialists. So let them know now what you're doing so that they can, it's fewer and far between, but I've seen it with these docs. They're like, hey, have you heard it from any of my patients? Because like I do give out your card once in a while when I
Yeah.
feel like there's this patient that like is
Is a
really
good
looking
fit.
for that kind of thing. Um,
That's
And
super cool.
also with the business to business is wellness businesses. So you do have to reach out to like the personal trainers, the alternative medicine docs, like the other people like in your community that may have some overlap where they're like, "Hey, we do a lot with wellness, but for our patients when they need something that's a little bit more clinical, a little bit more
Right.
doctor, like we now have someone that we think we know will talk more about lifestyle medicine instead of just recommending them to a PCP that doesn't have the time to support that wellness. Because whether you're functional medicine, whether you're alternative or complementary or alternative medicine, a lot of those are very much grounded in lifestyle interventions being a key component of what they
Yeah.
do,
Yeah.
whether it's a form of stress management or diet and exercise kind of thing.
Yeah, super cool. I mean, there's just so much that you're teaching and learning and growing in, and I'm sure like this is just the beginning. I mean, there's so much still to come. I think we've actually run over time by a significant amount, but I
Oh, I'm sorry
love
about that.
no, 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 no. Nope, no apologies needed because I love it because of how deep the conversation has gone into the different nuances of your practice, but also the different, ideas of how you get connected. I mean, that's what you're teaching. That's what you're kind of like helping your patients with is connection. I mean, the mind body connection, but also the healthy interpersonal connections. And you're doing that with the B2B side, but also influencing your own community as well. I think it's just really awesome to hear that. And where can my listeners kind of get connected with you or your business or, obviously if they're in the Massachusetts area, but kind of narrow that down for them.
Yeah. So, I mean, obviously, again, I'm on a narrow path. I'm still practicing traditional medicine. So, I'm only registered to practice medicine in Massachusetts. So, I know your podcast may go out broader. Unfortunately, I'm not a wellness coach. I can't practice
Yeah,
outside of my state kind of thing. So, I mean, anyone in Massachusetts, because I
there
do
you
the
go.
telehealth stuff, but I'm in Westford. That's like a suburb of Boston. So,
Yep.
anyone
Okay.
that's in Boston or near the Lowell, Boston area, even up to Nashua, New Hampshire is only like 20 minutes from me. And
Yeah,
so they
yeah.
can just cross the border. So my brick and mortar practice is in Westford, Massachusetts. They can find me if they just want to learn a little bit about this stuff.
Yeah.
I'd say the starting point is go to my website. It's w.extendedhealthspans.com. And so that is health spans plural. And I mean, I think I do like the website looks pretty good. Extended Health Spans does have like a light social media presence. So there is and they could help me a ton. They could become Extended Health Span Instagram followers.
Yeah. There you go.
It has a place there. Extended Health Spans has a Facebook page, and I and Extended Health Spans are on LinkedIn kind of thing.
There
So
you go. Okay.
reach out.
I'll definitely include all those links as best I can in the posting of the podcast too, so we
Yeah,
can get
I
people
appreciate it, Ben.
connected. Yeah. Well, thanks for your time, Stefan. It was a great, great conversation. Really enjoyed getting to know you and getting to know your story.
Yeah, thank you so much for having me on. This was a pleasure. I hope that I didn't over talk you.
No, I mean, because it's all good stuff. And so that's why I like hearing good stuff from good people.
I just get excited and passionate about it. I mean, I just love this stuff. I could
I
talk
can't
forever.
tell. I can't tell. It doesn't show. Well, thanks for
Awesome.
your time today. We'll let you
Yeah,
go and
take care.
have a great rest of your day.
Thank you. You too, Ben. Stay
Thanks.
safe.